Hi, and welcome to Girl Talk. It is a glorious, albeit a little bit natty day today.
A little
We
natty.
are talking about how lucky we are to be here in the Lowcountry, and it really is fabulous. But sometimes the gnats just are part of the spring process. I'm really excited. Caroline Klepchick has joined us.
Thank
from
you.
ROC Dental.
Yes, thank
it's
you
so
so-
funny when you walked in and I was like, oh my gosh, I think I know you. Go, Debi, 30 years.
I know you.
Your father-in-law
Right.
was in leadership with me in like 1991 and
yes.
92.
I knew Andy would have known you and spent time with you.
And then at the time, Little People.
Yes.
So tell me a little bit about your history, Caroline, and what
Sure.
you're doing now with Dr. Matt at
Yeah.
ROC.
So thanks for having me. It's so beautiful here. And I told Dr. Matt that I wanted to hold a little baby goat if possible, but I don't see any. But yeah, thanks for having me. So Dr. Matt asked me to join his practice last summer. And so we talked about it and I finally joined and I'm so happy. My background is basically medical. I've been in chiropractic and internal medicine. I've worked
Surgery.
for several doctors, just filling in time. So lots going on, but this change has been great for me, and it's a learning curve. I love it, and I know a lot of people here, so it's fun to see everyone coming in the door.
Well, what's really fun is when I ask you what you did, it's basically a PR position. You're really director of first impressions. You're right at the
Right.
front.
Yep.
What are some questions that people really want to know? And all I can think of is COVID, mask,
Right.
you know, what's going on moving
Right,
forward?
right.
What do I need to be doing?
Yeah, well, we're just so excited that finally we feel like we're making progress on this COVID, and we're going to see this mask mandate, which is exciting, but it's still a little bit nervous. We're still in that, critical time where we
Sure.
still need to be careful, but we'll follow all of the ADA and the CDC guidelines and keep all the protocols in place. But it's certainly great to see all the patients coming in. They've been vaccinated. They're more comfortable. They're getting back into their normal health routine. So they're coming in for those cleanings. They're coming in for the restorative work. And so it's great. It's just great. Even the Zoom, like people are just coming out of the woodwork, which is great.
Which is so much fun.
Right.
Can you talk to me a little bit practically? If I want to make an appointment, what are your recommendations with how often, how far in advance, what information when I'm calling is really helpful for you?
Yeah, so it's really easy. I've got great girls at the front. I'm at the front. Everyone's friendly and easy to talk to. So, you're going to come in. You're going to let us know or call us, or you can also email us.
Okay.
Yeah, through our website. We have a great system. So you'll just let us know, when your last cleaning was, if you're behind because of COVID, what kind of work you've had done, and if
Okay.
you're a new patient, then you'll have a comprehensive exam.
That
But,
was my question.
yeah.
If I'm new, what can I expect?
Yeah, so you would come in and the doctors would meet with you. We have Dr. Hare and we also have Dr. Matt. So we have plenty of space and time available. You can come in and sit down for an hour with the doctors. They'll treatment plan. They'll go over each tooth, see what kind of work you've had done in the past, any x-rays. So they have that great comprehensive exam, makes you feel comfortable. And then from then we can start scheduling cleanings and get you into your routine.
Talk to me a little bit about if I'm from out of town, because obviously we've got a
Right.
lot of people here.
Yeah.
If I'm a visitor,
Right.
Does it ever make sense if I come all the time, every summer, whatever, to establish a dentist on the island?
Yeah, we have several patients that actually live here 6 months and they live up in Ohio or up north every 6 months. So we correspond with their dentists up north, which is helpful. We can send records to them. They can send them down to us. We call them. So it's really easy for us to keep up with whatever you're having done when you're not on the island. And any emergencies, you can call us. We can get you in for, any emergency situation that you have while you're here on vacation. So it's easy, and we always have those emergency appointments available.
Is there a typical age or demographic that you see? Like, who is your typical dental client?
Yeah, we see all of it. I mean,
good.
so many friends of mine come, their whole family comes, the kids, and then they've got elderly parents that have moved down from up north, so they come in.
And that certainly will make it easier.
Yeah. So we have them all charted together as a family. We can, follow them, make sure they get in for their routine visits, accommodate whatever they need done.
I have 10 grandchildren, so
Oh my gosh.
I know. Be careful, right here. Exactly.
Yes.
Are adolescents pretty good at getting their teeth cleaned and their maintenance done.
Yeah, of course. I mean, you know, the moms are always making
Right, it's a
those
mom
visits,
thing, right.
But it's funny because they'll come in and they always come in all together. The kids all have their scheduled visits, the mom and the dad. So I see the whole family for like a month, which is great. But yeah, I mean, we see all ages. So.
Well, I tell you what, it's fun to see you, first of all.
Oh, I know, after
And
so long.
You have a son now.
Yes, I have Jack. He's 19.
He's 19.
Yes, and my daughter Ella is 16. She's at Christian Academy.
Oh my gosh,
Yeah.
where does time go?
I know.
Well, it is wonderful to have you. Tell
Thanks.
Dr. Matt we said hello
I
and stay with
will.
us.
Thanks
There's
so
a lot more to
much.
come here on Girl Talk.